Hello and welcome to yet another episode of Medtalk with Syed Raza. Tonight we are going to discuss about your gene. Yes, medical genetics. Medical genetics, as you all know, a lot of general population do not understand, and even we as healthcare professionals do not have much knowledge as to what medical genetics is all about. To discuss more on this subject, tonight I'm joined by a special guest, Dr. Cristina Skrypnyk, MD, PhD. She is a consultant in medical genetics who is European board certified in medical genetics and genomics. She is an assistant professor of molecular medicine at Arabian Gulf University in Bahrain, College of Medicine and Medical Sciences, Molecular Medicine Department at Al Jawahara Center for Molecular Medicine, Genetics, and Inherited Disorders. She has expertise in genetics and genomic disease, prevention, evaluation, testing, diagnosis, management, and counseling. And she has also great interest in medical education. So with that introduction, welcome, Cristina, on my show.
Thank you very much, Dr. Syed, for inviting me. It's my pleasure to be this evening with you.
Pleasure, yeah, as well. So let me start with a very basic and fundamental question, which most of the general population probably do not understand very well, as to what exactly is genetics. What is medical genetics?
Medical genetics is a medical specialty that it's dealing with the diagnosis of disorders who are caused by changes in our genetic material. And also not only with the diagnosis, but with the prevention, how we can help people to avoid this kind of disorders and have healthy children and healthy families.
Right. Now, the second basic question, again, sometimes even the healthcare professionals are confused about. Is medical genetics same as talking about a familial disease or hereditary disease, or there is some difference between the three?
Genetic disorders or hereditary disorders are almost the same because a big bulk of genetic disorders are inherited. I mean, they are coming from both parents or from one of the parents, but not all of them. They can appear also because spontaneous changes are appearing in the DNA, and nobody in our previous ancestry had it, now neither of our parents or cousins or grandparents, and just happened with us. But familial disorders are disorders who are sharing the same environment. For example, tuberculosis, it's a familial disease, and a lot of people are getting it because they share the same environment, so they are exposed to the same pathogenic factor. But genetic disorders may run in families, may not.
Yep. Okay, so I think that's clear. Now, of course, medical genetics has been there for quite some time now. Now, quickly, if I can ask you as to how has medical genetics changed over last 1 decade, over last 10 years?
I think the big change is that we move from a genetic medicine to a genomic medicine. In genetic medicine, we focused into the impact a change in a gene has into the sign and symptoms of a person. But in genomics, we take in consideration the environment influence into gene expression. And a simple example is what happened just recently with the pandemic. A lot of people came in contact with the same virus, COVID-19. Some of them had no infection, no signs. Others developed a mild form of the disease. Others developed a severe one, and unfortunately, some died because the same environmental factors action differently in a different genetic background. And in the same time, all these people had a different nutrition, a different exposure to stress, and so and so. So genomics is looking more holistically, and that's the way in which now we are aiming to practice medicine. taking in consideration all these factors and aiming to a personalized approach that is particular for each individual, not for everybody.
Sure. So you mentioned about the environmental factor. So may I ask here, of course, we all know that radiation and chemical exposure, they perhaps bring about some changes in our genetic composition. Is that right?
Yes, it's true.
So can you please comment as to how it leads to diseases?
Radiations are creating changes in our genetic material and are causing damages that sometimes cannot be repaired naturally by the DNA. DNA has the amazing capacity of repairing itself. But when this overload is too big, the mechanism of repairing are overcrossed. So then mutations, big changes in the genetic material are appearing. We all know that 1 out of 4 people in the last decade of life are having high risk to develop a cancer. And it's because of that, because of multiple changes accumulated in our genetic material who are not letting the genes to express correctly and can lead to chaotic divisions like are happening in cancers. So yes, radiations are indeed affecting our genetic material, and this can reflect on different ways: cancers, infertility, sterility, mitochondrial disorders, and plenty other things who are affecting the health of people.
Sure. So you mentioned cancer. So can you just name some of the common cancers that you come across where, genetic testing does help?
Yes, the most frequent, I think it's important for the audience to understand that there are 2 types of cancers. The first one that I was already explaining about are the polygenic multifactorial. There are some susceptibility in the genes, and then the environmental factors are just pulling the trigger and made this susceptibility to transform in the disease. These are the polygenic cancer. But there is also a category called monogenic cancers that are caused by changes in one gene or one pair of genes. And these genes are controlling cell division, cell death, and if they are having a change inside, a variation or mutation, how it's called in genetics, then that gene is not expressed correctly, and the cells where this gene is expressed are starting dividing chaotically. The most known monogenic cancer, genetic one, inherited one, are breast cancer, colon cancer, can be various type of multi-cancers. I mean, in a family, someone it's having leukemia, and then a cousin it's having breast cancer, and another cousin it's having lung cancer, another cousin it's having prostate cancer, pancreatic cancer. So actually there is a connection in between all these relatives in the family. There is a change in the gene who is controlling the stability of the DNA. And therefore, the DNA is getting erroneous translated, and it's leading to various types of cancers. Depends where that change is happening more. So
Right.
yes, this is called Lynch syndrome. And doctors are knowing that if you have a family with multiple people affected by different cancers, you still need to consider that might be genetic and ask for a genetic testing.
Sure. So common ones that I know are BRCA1, BRCA2, if I am correct, in breast cancer.
Yes, these are the most frequent genes linked with breast cancer, but breast cancer, genetic one, it's caused by more than 30 genes changes.
Oh.
BRCA1 and BRCA2 are the most known one and the most frequent one. And they are actually called like that: breast cancer A1, breast cancer 2. This is BRCA1 and BRCA2.
Right. And so coming to a related question, now, as you mentioned, some of the cancers may run in the family. So what will be your recommendation to screen or do a genetic screening for all the family members or some selected family members? Say, for example, there's a strong family history of breast cancer. So all the female family members should be screened?
Definitely screened by the oncology, under the oncologic care. But if we discuss about a genetic screening, it's different. So genetic cancers are having some particularities. They run in families from one generation to another one. They start very early, at an early age, and they are bilateral if they affect organs in pairs, and they are very aggressive. So as early you diagnose someone having a genetic change linked with a monogenic cancer, as faster you can help that person to enter in a very detailed and regular oncologic surveillance. And nowadays, there are excellent treatments that can prevent the cancer to develop more than incipient stages, and good therapies that can lead to high survival of 5 and 10 years. So yes, if there is a family history like that, together with the oncologic team, a geneticist can do a counseling first to explain to the people involved in that family, affected or healthy, what will be the benefit of a genetic testing, what are the pro and the con, and that's very, very important. People need to understand that the right to know is equal with the right not to know, and not always knowing it's bringing a big benefit. So after people are counseled and they understand the magnitude of a genetic test and the implication that will be not only for the person who is tested, but for the other people in the family, if they agreed and they have an informed signed written consent, then they can be tested for particular changes. As the geneticist, together with the oncologist, it's deciding which gene to be tested, if you go targeted for a particular gene, or you go extensive and you look to all genes linked to that particular type of cancer.
Sure. So now you mentioned the prevention and therapy. My question is there any breakthrough as far as the therapy is concerned? Is there any intervention that can, at a genetic level or a molecular level, DNA level, that therapy can be provided to the patient?
We speak in general for patients affected by genetic disorders.
Yes. Or any
Yes.
specific condition? Is there any intervention at the genetic level or DNA level that
yes, there
alter
are
the
now,
course of the
but
disease?
not for all. Yes, there are now intervention of the genetic level, as you mentioned it, but not for all disorders. There are new advanced therapies that are possible for some disorders for whom the research and clinical trials translated from the research in clinical practice, and they are approved by big scientific forums, by FDA, by EMA as therapies. And we have like that, we have gene therapies for some disorders where the defective gene is replaced in the body by a healthy gene that is introduced in the body with a vector. This is the classical gene therapy. We have gene editing therapy,
Right.
in which you are able to enter with some molecular tools inside of the DNA and repair the defect and go out. This is called CRISPR, and that's a Nobel Prize into that 2 years back.
Interesting.
And so and so. So there are therapies, and there are also therapies who are modifying the gene expression. They cannot correct the defect, but they can modulate the expression of the gene or of the surrounded genes who are interfering in the same process. So there are a lot of therapies indeed, but still limited if we consider the big number of genetic disorders. It's more than 25,000 genetic disorders we know, and we have just limited curative treatments for some genetic disorders. Hopefully, the years that will come will bring new therapies on the clinical practice, because there is a huge research done into that for a lot of disorders.
I think that's very interesting to know, and I'm sure that will be a big breakthrough as the research
We
goes
have
on.
a gene therapy for spinal muscular atrophy, that it's a little disease. We have gene therapy for retinitis pigmentosa, that it's a disease that it's leading to blindness, but only a particular type of retinitis pigmentosa caused by a particular change in a particular gene. So then you cannot extrapolate that for all types of retinitis pigmentosa. We have two products who have been recently approved for gene therapy for sickle cell disease. Maybe you heard in the press
all right.
over the world, and Bahrain, it's the second country in the world that approved that.
Right.
And so and so. So there are a lot of therapies, but what medical practitioners and general public need to understand, these are high-tech therapies. They have strict criteria for inclusion, which are the patients that may benefit. And they are not so simple at the general public. It's thinking you go to a clinic, you get an injection, and you go out cured. It's taking long time under supervision. All these therapies took very long time in clinical research and trials to really make a balance in between the benefits and the possible side effects. So it's possible, there are approved, but they are not for everybody.
And may I ask, what is the success rate? Particularly, we are in Bahrain. So sickle cell disease is a common medical condition. So what approximately is the success rate with the genetic intervention?
It's just approved like 1 month back. There is not yet one patient in Bahrain who had already this therapy. We will see in the years to come what will be the result of this gene therapy. But from the science and from the previous patients in the clinical trials who have been treated with the gene therapy, in 6 months, they've been cured by the disease.
Okay.
But again, we cannot extrapolate for everybody, and these
course.
patients need to accomplish particular criteria to enter into the gene therapy.
Of course.
And maybe a very important aspect to know is that these therapies are extremely expensive. We are speaking in prices of $1 million for one patient.
Right.
And they can be supported only by governments and only by the governments who have specific programs in this regard.
Okay, so I think since you mentioned about the price and the cost, so my important question is, are the genetic testing covered by insurance, medical insurance?
Unfortunately not.
Okay, so the person has to bear the cost, or the institution has to bear the cost.
In the governmental care, the genetic test is covered by the government in Bahrain and in other parts of the world.
Okay.
According to a limited budget that they have. In private practice, unfortunately, insurance, it's not covering neither the genetic counseling nor the expensive gene testing, unfortunately.
Right. Unfortunately, yes. Okay, now me being a cardiologist, now obviously I would like to know which group of my patients you think will benefit from not genetic testing, but genetic intervention. Common cases I see where I send for a request for the genetic testing are cardiomyopathies, could be directed cardiomyopathy, hypertrophic cardiomyopathy, sometimes patients with aortic dissection, aortic fluid dilatation, and so on. So are there particular group of patients whom you think, cardiac patients I'm talking about, may benefit from genetic intervention?
I think we need to split it clearly. Genetic intervention, if you are referring to therapies, are not yet available for cardiomyopathies.
Okay.
In the term that you are thinking, to have a gene therapy, to do a gene editing or something, not yet, will be on the way. There are a lot of clinical trials into that and big research. But in terms of doing a testing to clarify the genetic background of the clinical diagnosis of cardiologists, clinic and imagistic diagnosis, a cardiologist is making for a patient being an arrhythmia, being, as you said, aortic coarctation, or being cardiomyopathies, and so, yes, because a big bulk of this pathology can be genetic, and most important than that, it's having a heterogeneity, means that changes in different genes are manifesting clinically similar, and it's very difficult for the consultant cardiologist to say, okay, is this a cardiomyopathy caused by change in this gene or by change in the other gene? Because imagistically and on the symptoms, the patient looks the same. It's important to make the difference on the genetic cause, because exactly for what I said, in the future will be targeted therapies for particular gene mutation. And more than that, these kind of pathologies are quite frequent. There are 100,000 patients all over the world. A lot of research is done into that. A lot of studies is done into that. So we know now that a particular genetic change in a particular gene has this prognosis. And if you intervene earlier, you may change the progress of the disease. You will save the life of the patient, or you will win a lot of time to do the needed full till new therapies will come. So this can be a particular medicine that it's proved now that it's working better if a patient has this change or this change. Can be an ICD, an implantable cardiac device, who will prevent the patient to develop arrhythmia, or who will save a patient, diminishing the risk for sudden cardiac death.
Yeah, I think
So
that's again an important topic that you brought,
yes.
all these sudden cardiac death. And I believe that's an important breakthrough as far as genetics is concerned, that we can screen cardiac patients to identify not only their cardiac pathology, but the gene, what genes they have. Particularly, I can speak for the cardiomyopathy group. And now we know that which are the high-risk groups as far as the sudden cardiac death is concerned. So I think
True.
that's very interesting times as far as genetics is concerned.
That's true, and we both know that a lot of these cardiomyopathies are going silent for many, many years.
Sure.
And the first and the last symptoms sometimes is just sudden cardiac death, and you have nothing else to do, you lost the life. But then if you do earlier a testing in a family when someone already passed away suddenly and not because of an accident, then, a car accident or something else, a traumatic accident, and then you find out that that person or other people in the family are having this gene change, that it's exposing them to a very high risk, you will put them in a very regular and special cardiac surveillance, and then you can take the right decision to adjust the management to prevent this in time, an ICD and so and so.
Sure. Okay, so moving on, as we know that genetics, medical genetics has progressed over the number of years. And I'm sure you see lots and lots of patients, lots of varieties where medical genetics comes handy in making a diagnosis. Now, have you got any special area of interest where you feel that, that makes your day happy if you have diagnosed something using
I think we
genetics?
are all happy when we can help anybody, right? And when we feel that we make a good change in the quality of life and health of someone.
Yes.
And definitely genetic can do that, not only for that person, but for the extended family. I will say that there is a field that captivated a lot my attention for the past of 10 years. It's called genomics, and with the clinical application of pharmacogenomics, nutrigenomics, when you can select, for example, the right medicine for the right person in a special context. You may have a person who is, for example, diagnosed with anxiety, and the psychiatrist is prescribing an anxiolytic. But then, despite of the right dose that the psychiatrists know it's working, it's seeing that the patient, it's not improving at all. Now, if you do a genomic profile and you look to the genes involved in the cytochrome P40 in the liver, who are coding for the enzyme metabolizing a lot of medicine and substances that are coming in our body, you'll find out that that particular patient cannot metabolize the drug that you gave it.
Right.
So it's not for that person. So you need to look for a medicine that is accepted by the body, that it's correctly metabolized, it's not leading to side effects, and reach the therapeutic window that you want to achieve to put the patient on the right track. So pharmacogenomics, it's amazing, and it's getting more and more, acceptance in clinical practice, hopefully this test will decrease in cost, and hopefully insurance will cover this kind of tests, because they change completely the way in which medical treatment it's done. Will be perfect, one size fits all, not one size fits everybody with the same symptom or with the same diagnosis. The other field is nutrigenomics, when you can have a blueprint of the most important metabolic pathways in the body. You've been born with those variants in your genes, and you know for sure how you will do correctly, how your body is doing methylation, how your body is doing oxidoreduction processes, how your body is dealing at the cellular level with the inflammation. So then you will be able to modulate with the lifestyle and the food you eat, the gene expression to potentiate the genes who are not expressing correctly, or to modulate the genes who are expressing too much and can put you on high risk or predispositions. And this is really an intervention that we can do it. We still cannot go inside of all genes and repairing, but we can check what kind of medicine we take,
Right.
and we can check what food we eat daily. And we can rethink holistically to our lifestyle in order to help the genes to express to their higher potential. And this is called epigenetics too, right? So the way in which the environment is influencing gene expression.
Very interesting, I would say. Very interesting. Right, Dr. Cristina, in the interest of time, I'll just ask maybe a couple of questions, maybe 2 or 3. Now, the next question is, what are some of the challenges you face in medical genetics? Or what is the main challenge, if you would like to comment on? Will you think that's the cost? Is cost a factor?
Yeah, so one is this will be extraordinary if this field of medicine will get more attention from health insurance, and people will think widely that helping patients to understand about their genetic risks and planning in advance their families and their children will decrease tremendously the cost. Having a pharmacogenomic test will decrease the cost for medicine and for hospitalization, and will decrease the rate of side effects that are coming from medicine. And there are plenty of studies done all over the world. The costs are really, really reducing. So that's one, with the cost of the testing and counseling and specialized genetic testing. But I think another challenge is, and this I learned from my patients, is that many times it's too late. And they are saying, doctor, nobody told us about, if we knew it before.
Sure.
So I think we need a lot of education and a lot of awareness, and bi-directional for the general public. Everybody wants to be healthy, and everybody dreams to have a healthy, happy family with beautiful and healthy kids to accomplish their life. But few people are knowing about genetics and about the risks that we all have it. So if you know in advance, you will think consciently, shall I marry my cousin? Shall I go ahead and have a child, considering that in my family there is X and Y and Z having this and that? Shall I ask first a doctor if I am at risk or not? So education of the general public, it's one. And second is training in genetics of all medical specialties, because we all need genetics in our practice. You are a cardiologist and you ask me a lot of questions about serious disorders who are having a genetic background. And we both know that in all medical specialties, we face genetic disorders, sometimes without even thinking that they are genetic. Deafness, blindness, myopathies, regression, liver disorders, Wilson disease, and so and so and so. Plenty in all fields there is genetics, right? So if us as health practitioners are keeping our training updated with the knowledge in the field and with the, let's say, more than basic of genetics, and we work all in teams, because there is nobody the best. So in multidisciplinary team, and we collaborate and we ask our opinions, what do you think? What about looking into the genetics of that? Do you think this may be genetic or not? I think we will be able to help more people to live a better and healthy life and do prevention
Sure. Right, Dr. Cristina, in the interest of time, I've just got, I can see, I'm looking at the time, we have got just 2 minutes. We
Okay.
need just 30 seconds to wrap up. So very briefly, you can just mention the last question is a sensitive question. I left it purposely till the end. How about genetic counseling? If you can just do a very brief comment on that before I wrap up.
Genetic counseling is essential in medicine and shall be done by people who are highly trained. It's not just any kind of advice. It's not any kind of counseling. It's a specialized medical process that it's taking in account the medical history, the family history, a long process of building a pedigree and assessing if a disease is genetic or not, and if it's genetic, what type of genetic, if it's monogenic, if it's chromosomal, if it's polygenic, what type of inheritance is that, it's coming from both parents or only from one, and then delivering right information to the family and the patients. So genetic counseling, it's essential for people of avoiding genetic disorders, taking right decision in their lives, knowing the risks that they may have and ruling them out. And shall be done again by people who are highly trained, because otherwise you can harm more than you are thinking that you help.
Sure.
It's a lot of psychological component into counseling and is a bidirectional process. The professional is delivering information, but in equal process, in equal measure is listening, and it's getting the information from the patient and the family.
Right.
And counseling, it's not for only one, it's for the other extended members of the family in genetics.
All right, Dr. Cristina, that brings me to another question. And I know you see a wide variety of patients, different medical conditions, who come to avail your service of medical genetics. And I'm sure you're doing a wonderful job as far as the diagnosis. Sometimes they are difficult. Then they are actually made and a diagnosis is reached by doing these genetic testing. Now, can you recall from your experience, recent experience, or the experience of the number of years, any particular case you feel that the genetic testing might have helped to reach a diagnosis, and that might have changed the life of the person and obviously the life of the family members as well?
Definitely multiple cases, but I'm thinking of one that is in line with your specialty, and it's a very good example of what means teamwork and speed work, and what means to know genetics and to apply it.
Right.
So it's about a teenager who had a football game with the friends, and it's coming home. It's telling to the family, wait me for the dinner, I will just take the shower. And 30 minutes after, the family is realizing that he didn't join the dinner.
Oh.
So then they will go to the bathroom, they knock on the bathroom, nobody's answering, they open it, and then he was down without conscience. And of course, emergency, hospital, cardiology, thanks God, they saved his life. And then the cardiologist, after everything calmed down and the patient was out of danger, said, look, this is a severe arrhythmia, and at this age, this may be genetic. I want to have an opinion of a geneticist and to consider a genetic test. So we had a counseling for the entire family. We discussed a possible implication of a genetic background for this kind of arrhythmia, suspected by the cardiologist on ECG and everything being long QT syndrome.
Right.
And then the family agreed to have a genetic testing, understanding of the possible good implication if we confirm that is genetic, but also being aware of the implication for the extended family if the result is coming positive. So we done the test and we found a pathogenic change, variation in a gene linked for the potassium and channels that really confirmed the long QT syndrome identified by the cardiologist. And this changed completely the management, knowing the change, knowing the prognosis, the patient entering the cardiac surveillance, And then entire family had to go into testing because this is a type of autosomal dominant. One of the parents for sure should have it. And we tested, one parent had it, and in the extended family, many other people had the same variant,
Right.
but they've been lucky that by that age, as adults, nobody triggered. So was no intense effort to put the heart in danger, right? But now they know, and they are into a cardiac surveillance, and they are out of the danger for sudden cardiac death. So that was a beautiful example of what means to work in a team fast and to know genetics. And you know very well that the cardiologists are quite well trained in genetics because a lot of cardiac disorders are having a genetic background. And as fast as you confirm it genetically, the management is upgraded, changed, improved.
Yeah, no, sad, very sad. With that, I would like to share a story. Again, a sad story. One of my patients. Essentially, he was if I remember correctly, a 29 or 30 years old gentleman who was seeing me for a heart-related condition, which was not very serious. But when we did his ECG, so ECG looked like a typical Brugada pattern. So there's a characteristic changes on the ECG. And again,
Sure.
as you will know that this puts the person at risk of sudden cardiac death. Now, I was planning to do further tests on him, and then he lost to follow-up. And then he saw me 6 months later. And he was visiting his family he belonged to a Southeast Asian country. And then when he returned, and I asked him that, why didn't you come for follow-up? And it's been so long, 6 months or more, that you did not undergo these tests. And what he told me that while he was there on a vacation, he went for a short vacation, but he spent 6 months there, was that his younger brother, who was just 3 years younger to him, in his, I think he was 26, if the patient was 29, he died suddenly playing basketball. So obviously that kind of, made me more proactive to investigate him thoroughly. And we did some electrophysiological testing initially, and I don't think I sent him for genetic testing. But all in all, we decided with the electrophysiologist that he should have the ICD implanted. And
yes,
what
definitely.
he had, I don't think he went the genetic testing route because we made a plan to manage him. So yes, he had the ICD implanted subsequently. So yes.
Yeah, that's exactly as we said before. More people in a family might have the variant and they don't know. And the first and the last symptom, it's unfortunately sudden cardiac death. So if you screen genetically a family like that, you may save many lives because they will go fast on the ICD and a pacemaker implant or a defibrillator according to the type of the disease, and they will be safe.
Yep.
And they can go ahead with their life. Yeah, multiple cases. But the most important thing, I think, it's teamwork. I have other examples with young people who just done a regular checkup in a health center, and they done an ECG, and the family physician there said, you see, this ECG doesn't look very well for me, but I would like you to be seen by a cardiologist just to be sure we are on the safe side. And then the cardiologist said, this doesn't look at all good. Let's do an ultrasound. And then the cardiomyopathy appears slightly. You see, you are quite young. There is some family history with people who had a stroke or a heart attack. It's better if we do a genetic test. So in about 2 months was a diagnosis of a very rare genetic change in a gene linked to the cardiomyopathy. Without that medical doctor in a health center, that patient could lost his life. So important is to know genetics and to be willing to recognize that we cannot know everything. Working in a team, everybody is contributing, and in the end, we save a life.
Exactly. Yeah, I think genetics testing does come handy as far as the making the medical diagnosis is concerned. But in my practice, what I have also observed that patients, sometimes they are very apprehensive. They're scared to get themselves tested. And some of them, they point blankly refuse that, doctor, I'm
Yes,
not going
because
to
they
have the
need
test.
they need counseling. They need
Exactly.
genetic counseling done by professional trained people who are able to explain both sides and to present correctly the benefits and the side effect. And always the benefits, it's outweighing the side effects when it's about disorders linked with death.
Exactly. And particularly, I've seen a couple of athletes. Obviously, they are quite scared that, one, it may affect their career if a abnormal gene testing or the test is positive. And secondly, obviously, it will mean a, even a threat to their life or further whatever years they have got ahead to live. So they might just live in fear as to when they may drop dead. But again, as you said, counseling is important. Genetic counseling is important. And I tried to explain to them this, that one, it is important to recognize that abnormal gene may be lying in his body somewhere, in his body cells, I would say. But the other advantage will be to help the other family members, his loved ones, to get tested and diagnosed. And beyond that,
Yes, that's
there are
true.
therapy available, as you mentioned in the beginning, that there are lots that can be done. A therapeutic intervention is there. Medical science
Yes,
definitely has progressed. So we
true.
can prevent and we can provide therapy.
That's true. Absolutely true. And when people are getting the right advice done professionally, diplomatically, and with proofs, scientific proofs, they will understand. And linked with what you said about athletes, now the international guidelines is that professional athletes shall consider a genetic testing because their life shall prevail. So if you identify early, the path of training can be changed in order to preserve their life and to increase the quality of life. And we also, for sure, on world championships in football, in Olympics games, in swimming, people who collapsed, and unfortunately, some of them could have not been saved despite of the excellent medical team that was near them because it was too late. So yeah, genetic testing can bring a lot of benefits, but again, shall be considered, should be explained, prescribed pre and post testing with the genetic counseling done by professionals who are working in a medical team together with the consultant who initially saw the patient and who is
Right.
managing the
True.
cases, being a cardiologist, a neurologist, a dermatologist, an ophthalmologist, an endocrinologist, and so on.
True.
So we shall really consider this term of medical team in which all of us are contributing with our expertise for the benefit of the outcome.
Sure. Well, Dr. Cristina, I think so far it was a very interesting, very engaging, and very informative discussion I have had so far with you. I just wished we had more time and I could go on and on with more questions. And but before we conclude, do you have any message that you would like to give to our viewers?
Yes, medical genetics, it's a wonderful specialty. Indeed has big difficulties and it's dealing with a lot of dramas and disorders, but in the same time can help people to prevent. So genetic testing, it's not only for diagnosis, but it's also for prevention. Done accordingly can save lives, can redirect lives and help people live a better quality life for them and for their family. So I'm really opening the call for colleagues in different specialties to consider medical genetics as part of the medical team and to ask for our suggestion and advice in complicated cases where ruling out or confirming a genetic cause will make a big difference.
Well, so very well said that the medical genetics is not only for making a diagnosis, but it is also for prevention and therapy. And certainly I call it an important piece of the jigsaw puzzle as far as making a medical diagnosis is concerned using medical genetics. I hope, ladies and gentlemen, that was useful. And this was Dr. Cristina medical geneticist. With that, I would like to thank you, Dr. Cristina, for your valuable time joining me on my show, Medtalk with Syed Raza. And I wish you all the best. Thank you so much.
Thank you very much, Dr. Syed Raza, for your kind invitation and for such pleasant discussion. And I hope that the audience will have a benefit from what we shared together. Thank you very much. Have a good evening.
Good evening. Good evening. Thank you.